we are isolating patients because of infection, it can have a serious effect on their psychosocial well-being. That is on their mental health. So remember that isolation can lead to feelings of loneliness and depression, especially if that patient is supposed to be isolated long term. Remember when we even had COVID-19 in the world? Many people became depressed, especially when they had to go under isolation. So, one thing you need to know as a nurse is to engage patients in communication and provide emotional support so that you use that to combat the feelings of isolation. Because the last thing you want is for a patient to go into isolation and then come out depressed. What about children who need isolation? Children may experience higher levels of fear and anxiety. Hey, why have I been kept here? Hey, why have they prevented other people from coming to see me? So when you have a child in isolation, you've got to make sure that you provide age appropriate activities and engage child life specialists to support their emotional health. Okay? And so remember that pediatric patients don't think, oh, we've just isolated a kid. No, the child may develop some higher levels of fear and anxiety. So please make sure that you engage that child in age appropriate activities. Now, what is the patient education tip on isolation precautions? You've got to educate the patient on why the isolation is necessary and how to prevent the spread of infection from the patient to the healthcare worker, from healthcare worker to the patient, and from patient to patient. And you've got to also let the patient know the importance of following PPE and hand hygiene protocols. Okay, so you need clear, effective communication, which is essential for patients and their families to understand why isolation is being established.